All right, good afternoon, everyone. This is Jason Crosby with SHP. I want to thank you all for attending our forum today as part of our ongoing Winter Lunch and Learn series. Hopefully you are all logged in online to view the presentation, which we will upload to our site, along with today's recording within the next day or two. All lines are currently muted. Thus, if you have any questions, please let us know in the chat box or by raising your hand within the Teams environment as indicated on the current slide. Again, as a reminder, as usual, our webinar today is being recorded. And so today we will discuss the latest with the CMS vaccine mandate, including who it applies to, exemptions, timelines, and enforcements of those mandates. This along with related metrics, penalties, and the most recent news headlines. So obviously we have a lot to cover. And so with that, I'm gonna hand it off to Kelly Mooney to get us started. Kelly.
Great, thank you, Jason. Can we move on to the first slide? So obviously, a lot in the news recently in regards to the various mandates that were out there, which ones are still active, which ones the Supreme Court didn't allow to move forward. So as a baseline, wanted to sort of set what is still in play. So Supreme Court issued two separate rulings regarding vaccine mandates. The first was one that was being overseen by OSHA. The intent of that mandate was for all employers with more than 100 employees were going to be required to comply with that mandate. Supreme Court turned that one down, so that is not moving forward. The other mandate came from Centers for Medicare and Medicaid Services and applies to Medicare and Medicaid certified facilities. Critically, the Supreme Court did allow that one to continue. So in many ways, it's going to apply across the healthcare provider spectrum. And so with that, we'll move into the next slide and really who that is that it's applying to. So obviously not going to run down all of the categories, but it is basically being established as a condition of Medicare participation for certified facilities. That includes hospitals, critical access and PPS. It includes hospices, home health agencies, long-term care facilities, and ambulatory surgery centers, as well as the other provider types here. Critically, it does not apply to independent physician practices. Jason, can you flip to the next slide? So specifically, CMS does not have any regulatory authority to impose any vaccine or health service mandate on independent physician practices. So independent practices do not have to implement or develop their own compliance strategy around the vaccine mandate. Where it will come into effect for them, however, is any intersection that they have with a CMS covered facility. If you're a physician practice that also owns an ASC, obviously the ASC has to comply, and any physician or non-physician providers within those settings do have to comply. If you have staff privileges or round at a hospital, you will have to comply with their version of the vaccine mandate. But you as an independent physician practice do not have to develop your own compliance protocol. Jason, next slide. So the staff that are covered under this, CMS clearly outlined that it is not just clinical personnel that the facilities have to document compliance on. It very much applies to all eligible staff working in one of those certified facilities. It will apply to your current staff as well as new staff that you bring on. It will include the employees, licensed practitioners, students that come into the facility, trainees that come into the facility, as well as any volunteers that work within that facility. And, as we touched on in the previous slide, hospitals or ASCs will have physician practitioners that are not direct employees of the facility, but do provide services under an arrangement there. They will have to document compliance for those provider types. Next slide. So, a lot of practitioners or a lot of staff have moved into a remote work environment. So, CMS specifically addressed how this was going to apply to offsite or telework employees. And so, CMS will require within, administrative offices, within outside of just a formally clinical setting, that those employees do fall under the mandate. But if employees are full-time teleworkers or not in a administrative office or any physical setting within the hospital, they are excluded from compliance with the mandate. So in all settings, not just clinical on a hospital or an ASC campus, but if they're never on site at one of those locations, compliance is not going to be required. Next one. So critically, a big question that we have seen from lots of provider types are there exemptions to the policy? And CMS is allowing religious and medical exemptions to compliance. One difference, though, we'd seen a lot in the OSHA mandate that there was an option to simply test out without filing for an exemption. That does not exist in the CMS mandate. It is either compliance or an on-record medical or religious exemption has to be filed as part of their condition of Medicare participation going forward. CMS critically did not sort of set out the parameters of what those exemptions would look like. They have left that responsibility with the provider types, but they do encourage them to look to the EOC. So, for our practitioners, as you guys have worked with the hospitals, they likely have those developed already, but critically, that's being left to each hospital type. They also do not set out specific testing requirements if you do have a medical or religious exemption, but they are encouraging provider types to develop additional safeguards, which will likely, we believe, move into some type of ongoing testing for exempted practitioners or staff within those settings. Mike, anything to add there?
No, that's got it.
So what timelines are we talking about? The nation is really in two different sort of compliant timeframes. So there were 25 states that didn't object to the first set of mandates that were released. So they had proceeded under the original timelines issued by CMS. As you guys likely know, Georgia was one of the objecting states. And so their timelines have all been moved back based on the Supreme Court decision at the end of last year or so. Compliant timelines, initial dose is February 14th, so just a couple weeks from now. And then second dose is going to be March 15th. Right now, CMS is not requiring any booster doses to demonstrate compliance. It's really just the first set of shots. Next slide. In terms of documentation, so CMS is outlining that all facilities that have to comply with this need to have a process or plan in place for the documentation. They give a few different ways for facilities to meet this. So copies of the vaccination record card or a legible photo of the card, documentation of vaccination from a healthcare provider or an EHR record. And then for states that have it, the state immunization information system record. So it will be part of facilities' ongoing compliance and being able to document that for their full staff that are required to comply. Next slide. So CMS also did want to point out that vendors, volunteers, or professionals who are infrequently on site, i.e. annual elevator inspections or accounting services, Vaccination records are not required for those types of individuals who interact within the facility. So it's not everybody that comes through the door from a work perspective, but the vast majority of frequent employees and vendors that may interact. Next slide. So for enforcement of this, how is CMS going to track it? So similar to other healthcare compliance metrics, they're going to use their state survey agencies to regularly review this compliance. They're allowing those agencies to document in one of two ways: that the state survey agency is going to assess all facilities for these requirements during the standard recertification survey, or vaccination status via separate COVID-19 vaccine surveys. I don't think that we've heard from the state agency here in Georgia what their plan is, but the information that they are going to be looking to collect is going to be vaccination policies and procedures, the number of resident and staff cases over the last 4 weeks, and a list of all staff and their vaccination status. Additionally, CMS is working with the accredited agencies like DNV and JCO to require that they update their survey processes to include this in the survey process as well. So we would anticipate that would be part of the ongoing accreditation process in addition to the state surveys. And so in terms of sort of the status of how CMS is going to view this, the final sort of penalty available to CMS for non-compliant facilities is that they would lose their Medicare certification because they've made it a condition of participation compliance with this mandate. And so CMS has set up sort of 3 avenues to get back into a corrective action plan before that occurs. And so those 3 are immediate jeopardy, condition, or standard. And so immediate jeopardy is obviously the most intense version. It's a 23-day window once CMS determines that a facility may have met that status, and termination would occur if that was not corrected within 23 days of the notification. A condition corrective action plan would include substantial noncompliance that needs to be addressed. And standard level citations are maybe if you're just outside of the window to give you an opportunity to come back into compliance. Next slide. So in terms of sort of the metrics that CMS is going to be looking for in their surveys, so if it's less than 100% staff vaccination or exemptions on file, the facility could be cited. If by the applicable phase 1 deadline, the facility has more than 80% of staff that has done their first dose and a plan to achieve 100% staff vaccination or exemption on file within 60 days. And then if the phase 2 deadline for the second shot, again, that'll be March 15th, the facility has more than 90% of staff vaccinated and a plan to achieve 100% within 30 days of that date. So those are sort of the percentages that they are looking for to maintain that condition of participation for Medicare. So we had talked about the penalties. Obviously, the most severe is losing Medicare or Medicaid certification. Additionally, for nursing homes, home health agencies, and hospice specifically, there's also the avenue for CMS to level civil monetary penalties and denial of payment if compliance is not achieved. Monetary penalties are not for any other provider types that do have to comply. Those are exclusively to those 3 provider types. And as we had talked through the opportunities for corrective action, termination would occur only after the facility was given an opportunity to make corrections and come into compliance. So that's absolutely a last resort that CMS is looking at. So Jason, I think there was a question that had come in.
Yes. Question is, our situation is that we are a private practice under 100 employees, which will allow us to be exempt. The gray area is that we're concerned that is regulated by CMS. They have an in-house CLIA lab that is certified by Medicare. Where does that lead their particular clinic?
So CLIA certified labs did not fall under the CMS mandate. And so again, for a physician practice, it would only be where there's intersection with one of the certified facilities. In terms of staff privileges at a hospital that does have to document compliance.
Kelly, I think the follow-up question to that would be, can you describe, I don't know whether to put this in here now later on, but describe a little bit further for a typical practice that either has call that they have to cover at the hospital, or that there's times when they're playing hospitalist for their own rounding on their own patients, what that then triggers that they do have to comply with.
So we believe that most of the hospitals are like other similar CMS health metrics, like infectious disease testing, that it will become part of the privileging process within those hospital settings. And so the hospital will have to document compliance or an exemption on file for physicians in that scenario. That answer the question, Mike?
It does, and I think the point, as I look down the list here, I think there's two types of kind of providers on the call. There's a lot of independent kind of community physicians that are on the panel here, and I think hearing that we're exempted, kind of like Tina's question, doesn't mean completely we got nothing to do. There is some interaction and certainly some compliance, and especially as the hospitals issue their policies out to providers that they interact with, there's going to be interpretations of that you guys are going to have to keep up with. On the hospital side of that, that means you're going to have, and maybe y'all already do, you're going to have a policy of compliance that doesn't just cover your staff. It covers, as Kelly was saying, it covers the people that come inside the hospital to see patients or interact with providers inside the hospital one way or the other. Back to you, Kelly.
Okay. So next slide, Jason. So, and interestingly, news had come out last night. I think it's no surprise that there have been ongoing staffing shortages, certainly impacting healthcare facilities across the spectrum. So the governors of Virginia and West Virginia filed a joint letter to CMS last night asking for relief from the vaccine mandate based on those staffing challenges, that it was just going to leave them unable to keep staff on and keep facilities open, particularly in more rural areas. So depending obviously on CMS's response, there is the potential that it will set a pathway towards other states requesting similar relief. So definitely keeping an eye on that and how CMS responds to those two states. Next slide, Jason. So any other questions come in?
No more questions. And I guess just to kind of reiterate, the questions that we've gotten that kind of prompted this were really kind of more in that tweener place of, okay, if my practice is exempt, if I have providers that are covering call and then they turn around and interact with other staff back in our practice, which obviously they would, does that mean we should all be vaccinated? And the answer is generally, and Kelly can correct me, the answer has generally been the interpretation of the law through then as interpreted through the hospital policies is what will concretely govern that for you. I think that would be the expectation.
Agreed, Mike.
And we do have Erin. She has raised her hand. I've unmuted your mic, Erin. If you want to unmute yourself, you can ask your question.
Sounds like she's just asking for the slides, which we'll send out or post to the website, right, Erin?
Yes, yes. The website will be updated hopefully later today, as late as tomorrow.
Gotcha. All right. Well, anything else for today, Erin?
No, I believe that's it since we don't have any more questions coming in. So again, to reiterate, the slide deck and the recording will be posted to our website, hopefully later today, possibly tomorrow. But if there's any further questions that we didn't get answered, you can always shoot us a message. We'd be more than happy to help you at any time. Kelly, anything you want to add?
Nope, that takes care of it, Aaron. Thank you.
Okay, everybody, you have a wonderful day and stay tuned. We'll be sending out some more information about our future webinars and be sure to register for those.
Good deal. Thank y'all.
Thank you.
Bye.